lot of really good interviews. We're going to get you up to speed on everything that is planned. But, Chris, you were saying, and you've actually booked time with Rear Admiral John Menoni. He's been referred to as an officer and a gentleman. I know you said that before, kind of making reference to the 80s movie. I kind of wonder, because, I used to co-host the movie podcast that we did here, and this is completely tangential. So what we're
as usual, yep.
Yeah, what we're about to discuss with the Rear Admiral, and we thank him for giving us some of his time. But he's mentioned before when the governor was doing her Zoom press conferences that his background apparently is as a naval aviator. So I always wondered, what his feelings are on Top Gun 2 being pushed back. Again, this really has very little weight on what's going on with the state of the world, but because you're a big Top Gun guy.
Okay, Jay. So you'd want me to bring on the Admiral so you can ask him about what he thinks about Top Gun.
I was curious about people in that profession, how they feel, they feel about Top Gun.
We're just gonna stop everything with the COVID, Admiral. We're just gonna put on our naval aviator hat, which I'm sure you're wearing all the time.
And the jacket.
And the jacket, Jay. What kind of jacket do you want to see the Admiral in?
No, I was just curious about
Tell us, what kind of jacket?
Thoughts on Top Gun 2 being pushed back and Top Gun 2 in general. One of the more meaningful movies of
Admiral,
my childhood.
Are you there, Admiral?
I am, and I'm laughing at the conversation.
I don't know if you can, if that's above your pay grade or what, but are you allowed to disclose your thoughts on Top Gun, the sequel?
Being pushed back, and even the movie at all.
So if I may, real quick, the Army has the movie Firebirds, a Nicolas Cage movie, if you ever watched that. The Coast Guard's got The Guardian with Kevin Costner.
Right.
Air Force, their touchstone movie, obviously, is Iron Eagle.
Iron Eagle.
And the Navy has the greatest recruiting film of all time, Top Gun and Top Gun 2. So I'm super excited about it. I can't wait to see when it comes out. And my son, who's at the Naval Academy, is also pumped to see it. I will wear my mirrored sunglasses and my leather flight jacket to the first screening of that movie.
Oh, so Admiral, sir, I just got to ask you before Chris proceeds with this interview. Were you more, when you watched that movie, I'm sure, as in your youth, I would assume, were you more Team Maverick or Team Iceman?
I was Team F-14 Tomcat. It didn't matter. They were all cool back in the 80s.
Great answer.
What a safe answer. Are you done, Jay? Anything else?
Thank you,
you
sir.
Sure?
Yeah.
You sure?
Aye, sir.
Okay, all right. You sure you don't have any Blue Angels questions? Sorry about that, Admiral. That's my friend Jay. I can't really take him anywhere. He's awkward.
Oh, it's fine.
I'm sure.
Happier times, definitely.
Right on. And let's just get right into it, Admiral. We kind of wanted to start with, if we could, COVID-19 update for Naval Base Guam and anything else that falls under your jurisdiction at Joint Region Marianas.
Sure. So, like the community here, starting back in early to mid-August, we similarly saw a very rapid rise in active cases within the fence lines and then within the greater DOD community. And when I say that, I include not just the Navy, it's the Guard, it's the retirees, it's the veterans, it's the Coast Guard and the Army units, it's our dependents and our civilian contractors. And so we peaked probably about August 29th with, out of that entire enterprise, roughly 264 cases. As of yesterday at 1200, which is when we timestamp our reports, we were down to 54 cases across that enterprise. So we're seeing a lot of people graduate through our protocols, which include isolation and quarantine and testing. And we're seeing a very slower rate of people who are testing positive. That's also borne out by 0 hospitalizations at that point. We did have a few throughout this latest peak, as well as a slowdown in people coming into our influenza-like illness clinic for screening at Naval Hospital. About midway through this latest spike, we were seeing about 40 to 50 personnel a day every day. We're down to the 10 to 15 personnel every day that come through that ILI clinic for screening. So I think we're on the backside of our latest peak.
I did want to follow up. Did you have any information on the investigation and the personnel that tested positive? I believe it was in Tinian, because the release we got from the CNMI was that before this group went out to Tinian, they had tested negative. But when they arrived to Tinian, one of them had tested positive.
Yeah, so we did thank you for that question. We did a full deep dive into that, and we still don't understand how that happened. These folks tested negative before they deployed to Guam from Japan. Mm-hmm. They then boarded military aircraft, came to Guam, sat in a restricted movement, we call it ROM, but mm-hmm. it's ROM sequester, where they sat in their own rooms, in their own barracks, in a tight group for 14 days, tested negative again, sat for 3 more days, and then boarded a military transport direct to Tinian, and then one tested positive on arrival. To date, that individual has not shown any symptoms. I believe all 13 of the team, that's I think a team of 11 plus 2 close contacts, all have tested negative and are back at work. So we're not sure how that happened. It could have been a false positive. It could have been something he contracted by touching a door handle, but we don't know.
Mm-hmm. Okay.
I had a question, Admiral. I got a friend who lives by the Oka area, asking me about. You okay?
Sorry.
Yeah. Asking me about the people here for Valiant Shield. I know that I wasn't sure what the orders were for them, but they're saying that they see groups of these service members walking to and from the Sheraton. I'm assuming maybe they're going over to wherever. Can you just clarify what are the orders for military service members here for Valiant Shield? Go ahead.
So I think we have lots of different groups here on Guam. The Valiant Shield people that we see that are actually participating in exercises, that are boots on ground on Guam, that totals 890 people. We have thousands of people who are DOD or DOD affiliated who live here on the island. So he may not be seeing Valiant Shield participants. They may be off a submarine that's home ported here, or some other unit that's here for something else. But so for the 890 folks that are on Guam supporting Valiant Shield, that are living in 2 hotels, their orders are basically home to work and then back to home. So these folks, we worked really hard to make sure that they were COVID-free before they came to the island. And then, like I just alluded to, the Seabees, they came on military transport. We're trying to keep them clean because they're operational units. So that goes along our lines of, protect the force, protect the population, don't be a vector for this virus, and then continue our mission. We're really trying hard to protect this force so that they continue their mission. So I hope that helps to answer that question for you.
So if I'm one of the 890, I just have to stay in my hotel room?
You stay in your hotel room, or you go to work and then come back to your hotel room. There's no, hitting up Jollibee drive-through or anything like that. They certainly shouldn't be walking around. The folks over by the Sheraton are likely not Valiant Shield participants.
Okay. And then, Admiral, just to clarify, so if I'm supposed to stay in the room and only go back and forth to work, am I allowed to use the hotel facilities if I'm a member of the Valiant Shield exercise, like, for example, the swimming pool? Because I got a picture of a bunch of guys at the swimming pool. Is that okay?
Yeah, that's typically okay. They're allowed to do PT.
Right.
As long as they comply with the wear the mask, physically distance, practice good hygiene, and they're staying in their units, kind of like when we see a ship come into port and we allow them to go down to the beach, as long as they stay within their unit that we know is clean. I'm not going to legislate who gets to go down to the laundry to pick up their stuff, that they can't go in twos or threes or stuff like that.
Right.
I wanted to just give you the opportunity and just to explain to people why, for example, the governor will issue an order, right, where we have a stay-at-home order, we have a lockdown. So, and this is the first instance, there was a video that was going around about the USS Ronald Reagan when it came in, and people weren't wearing masks, and apparently they didn't have to. They were going to the beach on base, and then we had this other order about no construction. There was a directive that construction will cease, but yet the military continued with their construction projects. So can you just kind of explain to everybody why some people may say, gosh, it seems like there's, a double standard or...
Or, we hear you say a lot, Admiral, the one Guam approach, and I mean, it just doesn't really jive when, the one Guam out here can't do construction, but the one Guam in there does it anyway.
So, that's a great question, and I know it looks a certain way depending on where you sit.
Mm-hmm.
And if you're looking to, I guess, be offended is the best way to say it, you're going to view it in its most negative light. Whereas if you're looking at it from where I sit, I will have a completely different view. That doesn't mean either of those are invalid. It's just the way it is. So let's talk about the Ronald Reagan, and we'll talk about all the ships that come in. So we're on our 16th safe haven port visit. In your own homes with your family, and you have this tight group, and that your family is COVID negative, do you wear masks at home? And chances are people don't. Chances are people do practice some sort of physical distance with their own family. They do kind of get after each other for good hygiene, but they're not wearing masks because they know everybody within that unit, that family unit, is COVID negative. The film that was taken by Ronald Reagan, we're still looking into whether there was a violation of federal law by taking that film in a restricted area. But those sailors had been at sea for 100 days and were COVID negative, tested extensively, no symptoms. So think of them as, 4,800 of your best friends that you know exactly their physical status, living all under the same roof. So why would I put them in masks? The second question was with respect to, local executive orders and ordinances. I talk to the governor all the time. I mean, all the time, whether it's during the week or the weekends. My staff is directly engaged with the governor on all of these things. And we, try to mirror as best we can the local ordinances, understanding that we have different mission sets, different populations, and we are beholden to different constituencies. My chain of command, unfortunately or not, does not go through the local government. It goes through the federal government up to the president. And so I have to respond and adhere to executive orders through Secretary of Defense to me. But I also have to try and do what's right by the local community. So there's some things that I can do, which, ratcheting down on HB-Con levels to become more restrictive when the governor is more restrictive. Try to mirror that as best I can. Close the beaches on the bases, even though I don't really have to. We did that because the governor has done that. Our beaches on Naval Base Guam and on Anderson are closed, period, end of story right now, not open for physical fitness. So we're more restrictive than the governor and the government right here. But when it comes to stuff like military construction or critical infrastructure, critical to national security, there's executive orders that say what we can and cannot do. So again, you could look at it as a double standard or whatever you want, but you got to understand the context of these decisions.
That's why we asked you, so you can explain.
Yeah, I appreciate the question. It's a good question.
Can you tell us anything else about, the Ronald Reagan was here, and then I've seen all kinds of media reports that there were, it didn't say how many, but there was a sailor or sailors that had tested positive for COVID.
Right, and so when you see
after they left Guam.
when you see the backlash that we had, Admiral, when that video was going around. People were saying, oh, and then you guys' response was like, oh, they were in the bubble, it's COVID-free, and then we come to find out that, oh, they got the virus on the Reagan. So it's kind of like, I mean, were they, what happened?
That's a great question, and there is a very big effort right now by both this headquarters, Naval Base Guam, the strike group, which is, I believe, CSG-5, and 7th Fleet to try and understand how this happened. So in spite of all the protections we put in place, and I remind you that, we had 15 other ships, to include the Nimitz strike group, come in and follow those same protocols. Well, we actually were even more restrictive in terms of distancing and bubbles and who provided security for what with Ronald Reagan. How this happened and what the vector was onto that ship. And it could be something as simple as a contractor from the local community who maybe was asymptomatic positive, went and serviced a vending machine on the pier, and then when they went and sanitized those vending machines, they missed the spot, and Sailor X went and touched the vending machine. Or it could have been something that somebody who transferred to the ship was asymptomatic positive, and it just got passed around. So we really don't know, and there's no clear smoking gun, to use a cliche, of where this came from, that we know it came from this vector, but we are fully digging into that because we want to know, and we want to make sure that we have our procedures tight to continue to allow these ships to come in for safe haven liberty, because you probably know when you're on a ship for 100 days straight, it gets a little crazy.
I also wanted to ask about, we spoke with Lillian Posadas earlier this week, and she had mentioned that you had toured the Guam Memorial Hospital, because we've been asking her about, the DOD team that's here helping GMH with the hospitalizations, because they're in dire need, obviously, of help. And so can you provide us, I guess, JRM's role in all of this? Is
Sure.
it because you're representing DOD?
So, I think it's my job as the senior military official out here, regardless if people are in my chain of command or work for me or not, to go out and see how people are being employed and what's the actual true story on the ground. It's something that's worked for me for 30 years in the military. I got to go see what's going on. I can't just take email reports or phone calls from people. So I went over to see how our DOD personnel were being employed, and to talk to Lillian and Dr. Uggan over there to understand, what their challenges are. I've done the same thing with Naval Hospital, as well as I have not gone over to GRMC. Mm-hmm. But as you know, when TR was here, I was doing that same thing, touring the different quarantine facilities to try and understand what was happening. It is a big challenge when you only have 3 hospitals on the island, and you don't have another state next door that you can rely on for additional help. That we're 7 hours of flight time away from Hawaii and 25 hours of flight time away from the East Coast of the United States. So it is a challenge. So I'm always very concerned about hospital capacity and ensuring that we have capacity to support these outbreaks. So I hope that helps answer why I went over there and looked around, and what I'm thinking, I think the team that's here, while not certainly as proficient as Dr. Uggan and her team, who have been dealing with this since March, on the front lines, their efforts are very well appreciated by the GMH staff, and Lillian and the team have them working hard over there right now.
Right.
So they're fully engaged.
So you were satisfied with what you saw during your site visit?
I'm never satisfied when we don't have enough staff and we don't have enough resources. So I'm always going to continue to try and fight for those resources. But I also understand that, the budget is not unlimited, and we are fighting a global pandemic where medical professionals across the world are being stretched thin and worn down to the nub, to include DOD. So I'm going to continue to advocate and fight for resources for Guam. As you know, we have a standby hospital sitting down at Santa Rita. Should we need the bed space? Right now we don't. What we need are staff and providers. But I also am a realist and understand that everybody is stretched pretty thin right now.
Do you have any update on the closure
Of the Visitor Control Center? Yeah, we got a couple comments on that, Admiral.
Sure, they're just cleaning. They're working through to make sure that space is safe. They're doing, obviously, contact tracing to try and understand how the Visitor Control Center employee became positive, was infected, and then make sure that we work with public health on that to make sure that it doesn't, blow up. And obviously, as the VCC is a pretty high traffic area, we don't want to endanger the community any more than put them under any more risk than we already all are at this point. So I think we're about a day or two from opening that thing back up.
And
I think with VCC, though, you guys, contact tracing would be pretty easy because you guys keep a log, right? You know what time people are coming in, who's coming in, and
Yeah, I don't like going down to the VCC because I feel like I'm getting, the 10th degree when I walk in there, with you got to log in, you got to do the temperature check, you're getting, queried about your past history, and I might just be coming in to ask a question, and I got to go through this whole process to get in the front door. So I'll tell you, Captain Shali, who's acting right now just for a couple more days, and his team at Naval Base Guam, when they did a quick investigation, they don't see any bad behavior on the employees' part, and they don't see any breakdown in protocols at the VCC. That it seems like everybody was doing everything right, but this virus, the nature of it is so insidious and so contagious that you don't know you got exposed until you pop positive on some test or you display some symptoms.
Right. So in the meantime, Admiral, what's the procedure for people who are trying to get in to the base that would normally go to the VCC to do so?
Yeah, I got to hold off on that. We're standing by on that. I don't think we've caused any sort of issues with, or I certainly have not heard of any issues with people who absolutely had to get on base were denied access.
Okay.
One of the things at the Guam Memorial Hospital, they, have suffered a significant shortage of staff because of healthcare workers that have doctors, nurses that have tested positive at GMH. What about over at a Naval Hospital?
Yeah, we, throughout the DoD enterprise, despite our best efforts to keep these bubbles clean, whether it's on Naval Base Guam, up at Anderson, at Naval Hospital, we've seen positives within those fence lines. And it really all started early to mid-August. I think, by my numbers, we were at 0 cases within DoD on August 8th, and within that entire enterprise. And then by the 29th, we were at 264 cases. So Naval Hospital has seen some positive cases within their building, but one of the things that Captain Scott over there has done and did right away was start to reduce non-essential services so that she could build capacity or hold capacity in reserve should she see more positives within her hospital, and to ensure that she had enough providers on hand to treat patients appropriately. We have that luxury at Naval Hospital for a couple of reasons. One, I think the population that goes there, although we do have retirees and veterans that go to Naval Hospital who are maybe a little bit older, we have a little bit younger population that frequents that hospital. And then the second part is, we don't have to worry about generating revenue. So we have a different problem set than GMH or GRMC does. You can't really equate how we do business within the Naval Hospital to GMH. They have, I think, a much more difficult problem set.
I wanted to just go back to Valiant Shield. I know we talked a little bit about what the question that Chris asked, but I wanted to just ask in general, how has Valiant Shield been going?
So no news is good news. We do keep close tabs on how the training is going. If I may do a little bit of a public service announcement on Valiant Shield, because I think people are rightly asking the question, why are we still doing training during COVID-19? And in its inception, in its original form, Valiant Shield was a massive U.S.-only exercise that was going to be conducted here in Guam, the CNMI, the water surrounding, linking Japan, Hawaii, Alaska, CONUS here, virtually and in real time. And, we have an obligation as the U.S. military to provide for the defense of Guam and the Marianas out here, as well as all work with our allies and partners for this concept of a free and open Indo-Pacific. You can't do that. You can't meet that obligation, that Title X responsibility, unless you train. But in light of COVID, JRM, working with Pacific Fleet, who is the exercise, the lead, scaled things back and put in procedures in place that would minimize any threat of COVID transmission to the islands, because we understand about hospital capacity and the concerns of the local population. So, we're doing high-end training at sea and from Anderson Air Force Base. The training from my conversations with the strike group commanders is going well and is very, very appropriate and needed. But we're also being very careful to protect our service members, not be that vector to the community, and keep continuing that mission. So I hope that answers that question.
Admiral, we had gotten a couple, and I think, was there something nationally on Frank Cable coronavirus?
I think Nestor may have done a story.
Right. So what can you tell us about the Frank Cable and COVID-19, Admiral?
So Frank Cable is a ship that's home ported here. So I need people to think of Frank Cable as just like Naval Hospital or the 36th Mission Support Group at Anderson Air Force Base. So home ported here, part of this community, and they had an outbreak on the ship. That ship is 1,000 people. So when I look at the numbers, and I'm not going to go into specific numbers within that unit, but when I look at the numbers associated with Frank Cable, as opposed to the numbers associated with 36 Mission Support Group or USS Asheville or JRM, their numbers were in line with everything else that we saw during this recent spike. And their numbers were rolled up in that peak of 264 that I told you that was DOD-wide here on Guam. So, there was a lot of stories about it and a lot of concern, but from my view, my seat, it was the ship and the crew stepped through it appropriately and got themselves healthy again.
So it's everyone has been cleared.
As far as whether they have any positive cases on board, I'm going to take a quick look. And I think they're still working through a few cases.
Okay.
But again, I ask you to remember that, it's a 1,000-person command.
Yeah.
Okay.
I wanted to ask about on the subject of the training, because I think I did a story, I want to say last year about Sonar. There was a training you guys had done, and then we subsequently saw a whale washed up, and they believed it could have been linked to Sonar. But that being said, I know a bunch of senators are today going to be adopting Resolution 365, which aims to urge the U.S. Navy to cease its use of active sonar that harms marine mammals in identified habitats. A comment on that, Admiral?
So, I've read the resolution and had my team look at it, and Pacific Fleet also has looked at it. And I believe the resolution asks us to do things that we're already doing. They talk about standoff distances, which we do. They talk about, in that resolution, hey, we want the same procedures that are used in Hawaii and SoCal to be used out here. Those procedures aren't site-specific to like Hawaii or SoCal op area. Those are fleet, Navy-wide procedures. So we do ships that are operating around the Marianas operate in exactly the same manner as they do in SoCal or in the Hawaii operations area. There is no desire on the United States Navy's part to harm marine mammals. That's just not how we roll. When we say we want to be good stewards of the environment, we work really hard and expend a lot of resources to be good stewards of the environment. So I am grateful for the Senator's concerns about the environment, about marine mammals, and people got to know that we have those same concerns, and we put a lot of time and effort into making sure we don't make things worse. Mm-hmm. So that would be my comment on that. Mm-hmm. I hope that's helpful to you.
Do you have any comments on Secretary Esper's visit with the Japanese Prime Minister and the Marines relocation?
So, I wasn't in that meeting.
Mm-hmm.
I had some time with the Minister Kono as well as Secretary Esper, not only with Governor Leon Guerrero and Secretary Esper, but also some time after that. And both him and Minister Kono are very appreciative of the support that the people of Guam have given not only U.S. DOD, but also our very close allies out of Japan. And, they view things, I believe, the same way I think all of us do with respect to Guam and the CNMI, is that this is a strategic point on the globe. And there's a lot of focus on this area, not only from U.S. Department of Defense, but also our close allies in the region, but also our adversaries. And we have to keep our eye on the ball out here, that it's not a function of whether DOD is here or not, whether Guam and the CNMI is strategic. It's strategic because of where it is in the world. And, we just have to make sure we're doing things right for this region, because Guam and the CNMI are key to that concept of a free and open Indo-Pacific.
Admiral, I wanted to ask, while we're talking about this realignment, and we had the Shippo on. I think we got to get Shippo on again. But I know that he had initiated the Stipulation 13 process, and we've seen very significant archaeological discoveries up at the build-up construction that's going on up north. Mm-hmm. So can you tell us from your viewpoint and where you guys are sitting at the table, where we are in terms of that 45-day halt, and where we are in terms of a kind of allaying a lot of the very valid and real concerns that our people have about how these sites and how our ancestors that have been bulldozed in some cases, how they're being treated?
So with respect to the current discovery, what we believe now is an actual burial site.
Right.
I just sent a letter back earlier this week to the Shippo, which aligns how we want to proceed with the Shippo and the governor's desires to preserve in place and to memorialize that site. So we're going to do some things with respect to that specific site that I think will treat the people who are buried there with the dignity and respect that they deserve. I made some comments when I first got here that the days of DOD being, I think I said something like Yosemite Sam on a bulldozer just plowing things under, those days are long gone. And I still hold to that comment. When we're up there trying to execute the National Defense Strategy and the Program of Record for the Defense Posture Realignment Initiative, which is the Marine relocation in this case for Guam, when we're trying to execute that, we're very careful on how we do business. And when we see something or find something that we don't understand, we do a pause. We stop work. We fence off that area, and we get the best experts that we have on island and off island to try and understand what we're seeing, and then determine in conjunction with Gov Guam through the Shippo how best to proceed. And it's not a, hey, DOD is just going to do this, unilaterally. It's a conversation and a consultative process. So I think our relationship with the Shippo is very good. We don't always see eye to eye, but no good relationship always agrees 100% of the time. We try to work through things together, and that we try to be the best stewards of those cultural resources, those historical areas, and then obviously the environment that we can be.
So, Admiral, it kind of sounds like you were alluding to a determination about preserving these sites and these burials in place. Is that what's going to happen, or is that just what's being discussed?
With respect to, again, this is specifically the burial site
right.
that we recently found. It is DOD's position that we're going to likely preserve in place and then memorialize and adjust our plans, our build plans, to accommodate that preserve in place. So, it's not a hard line, hey, we got a plan to build something here. We don't care what we find. So we're always evaluating and adjusting and then evolving our thinking. I think the entirety of the Guam enterprise, so all of us, both DOD, the local government, and the population, is evolving their thinking on what happened in the past on that northern plateau. And call it what you will, one of the benefits of this buildup is that resources are being applied to the tune of, I think, more than $100 million in environmental mitigations over the past 4 years, to understanding what's going on or what went on in the past. We may not have understood those things had we not done this buildup. That's not to imply that that what we do is right every day. We got to figure out this together so that we can execute the program of record.
Oh, just one more question on this, Admiral.
Sure.
So, in hearing about the discovery that was made, it's a significant ancient burial that we've only really read about in, historical documents. So that being said, what is the likelihood that we would be able to see any type of photographic evidence of the site? Or, just because, like, for example, my kids, I told them about this thing that they discovered up there, and we just kind of want to see, and obviously we're limited in how we just can't even go to the site. First of all, so because I really think it would go a long way with the community to kind of, instead of us just talking about this as some kind of abstract concept, to really give us some evidence that, hey, we told you guys how we're treating this site. Here, take a look at it. This is what we're looking at. Are we able to get that type of, visual confirmation, while at the same time mitigating all the whatever force protection and national security issues that I'm thinking are obviously in place up at that area?
Yeah, that's a great question, and before it was overcome by current events, there was the intent of, and by current events I mean COVID.
Right.
There's the intent to work through more open access for these types of things. So the Marine Corps base, Camp Laz, when that is fully implemented, we're working through a visitor center at the front where you can see artifacts on display as well as see photographs of what was found on the base. There's the potentiality for organized tours to the base. Obviously, this burial site will at that point probably be preserved via cairns of some sort of memorialization because you don't want to leave it out in the elements, but there'll be photographs of that as well as placards that discuss what was there. DOD has funded, it's been in the news here recently, this cultural repository to help preserve not only stuff we find on federal land, but things that Gov Guam and local construction companies find external to the fence lines. And obviously there's concerns of who's going to maintain that and how it's going to be funded, but I think the first step is the fact that there's money appropriated to actually have that cultural repository on island and then things done the right way so that we don't damage these artifacts. So the intent is to continue to try and get the message out and show people what we're finding. And then you did allude to the national security type concerns. More of a concern for me right now, and though we have taken some senators and the governor up to see this current burial site that we've been talking about in person, more concerning than the national security concerns are just the safety concerns. Because even when I'm up there and looking at the different projects that are going on, I'm concerned for my personal safety because there's a lot of heavy equipment moving around. So we're going to work through that, and we owe the public more transparency as best we can on what we're finding and what we're seeing. And it's my commitment to do that moving forward.
Yeah, I think what he's really asking is, can we, the media, go and get video on our own and get a look at what's happening?
Yeah, that's something we got to work with the Shippo because there's some cultural sensitivities there that I don't necessarily know about or understand. So we'd have to work through that. I think that is a media day is an appropriate request. I just don't know if we should do it. So we'll look at that.
Okay. Yeah, we're willing to do whatever we need to do to be able to get on there and get a look at what's happening. Before we do let you go, though, I wanted to get an update because we have gotten releases in the past about naval exchange.
Oh, it's still open.
And were there any COVID cases, any employees there that tested positive?
Absolutely. There were, just like again, across all the bases, across all the different units on these bases, there were positive cases within the Navy exchange. And like these, all these organizations, we mitigated that. We shortened up some hours so we can do better cleaning. We actually did consider closing at one point the exchange and the commissary for a couple days to sort it out, but we decided against that because, one, I thought that would be an overreaction, and two, and send the wrong message, and two, we weren't seeing transmission from employees to patrons. We were seeing transmission among employees, and that transmission started back off base at home. So there was no real need to close it. So they're still open, and my intent is for them to stay open unless we see that we're actually endangering employees or endangering patrons.
All right. Is there any final comments, any final message you'd like to give?
I appreciate the time. I mean, I think we've been on the air right now for 45 minutes, and
right.
that's thank you guys for these questions are great. And I am a consumer of the local media also, so I see the questions that people are posing, and a lot of the questions are because we're still not able to communicate as best we possibly can. So I will continue to try and do that. I will continue to try and give the facts as I see them so that people can form their opinions based on those facts, whatever those opinions may be. And I commit to still continuing to work with local leadership here to do the best we can both inside and outside the fence lines. It's never perfect, but we're going to try to do the best we possibly can.
I definitely appreciate your time, Admiral. And the door is always open. You got the number. You got our contacts. Anytime you want to jump on, we'd be more than willing and glad to have you. There was a comment in here. It's nice to see the Admiral doesn't limit you guys to one question and one follow-up question.
Yeah, it's more of a stream of consciousness.
Right, yeah. Some might say word vomit, but...
Next time, let's talk about happier things. Let's talk about
Top Gun. You want to talk more about Top Gun? Hey. Yeah, we'll bring Jason in and we'll do it.
Friendly sports.
Right.
All right.
Okay,
well,
Admiral.
Thanks, Admiral. And also a shout out to Lieutenant Commander Rick Moore for helping link us up. So thank you so much.
Right.
Yeah.
He's good people. Thanks, guys.
Thanks, Admiral. See you. Wash
Take
your
care.
hands. Okay. 8:54. We got to take a short break. We're coming back with elected Attorney General Levin Camacho next on the link. It is The Breeze, 93.9. Good morning.
For DIY projects.
GU Self Storage, conveniently located near the